Up first this evening, the country now awaits government's plan of action following news that the Delta variant has been detected in Jamaica. Now, TVJ News broke the story earlier today, which has heightened concerns about the spiraling COVID cases and hospitalizations. Jamaica Pullen reports.
The fast-spreading and deadly Delta variant has been detected in more than 100 countries. Worldwide, it's been labeled as the COVID variant of concern. It's been long felt that it was only a matter of time that it would be detected in Jamaica. On Wednesday, confirmation by the Health Ministry.
We have received, finally, some test results out of the Caribbean Public Health Agency. 60 samples were sent, 40 were useful for testing, and 22 have come back confirming the presence of the Delta strain of COVID-19 virus in Jamaica. This, of course, confirms what we had suspected all along, and it is a clear indication that the Delta is a dominant feature of the virus, the COVID-19 virus in Jamaica, and it does represent additional concerns.
Dr. Tufton says hospitals are now getting to the point of overcapacity, making it difficult for health workers to respond.
It's going to mean some drastic decisions, I think, and I'm speaking purely from a public health perspective. It's going to mean suspension of a number of services. I've seen where hospitals are now looking to carry more COVID patients than regular patients. So it's going to mean a prioritization on absolutely emergency cases, and we're going to have to find ways to deal with the personnel, because our healthcare personnel are under severe stress.
As for the government's next move now that the variant is here,
it is not up to me to determine restrictions. It's a cabinet decision, and I will certainly provide all the advice and information based on the consultation with the experts to the Prime Minister and the Cabinet. I will say, from a public health standpoint, we have been, in a sense, managing under the assumption that the virus was here. We have said it publicly. We think it explains also the rapid spread and would have contributed to the pace of the surge.
Public health specialist Dr. Alverston Bailey, however, has been more direct in his recommendations on what should happen now.
All employees who can work should now consider working from home. The government needs to ramp up contact tracing, isolation, and quarantining of all those who have been exposed to the virus. I suggest that we return to weekend lockdowns this weekend, and that we start to rigidly reinforce COVID protocols with deployment of trained marshals to contain the behavior of the reckless and the careless.
The Delta variant was first identified in India, killing tens of thousands of people. Reports suggest it was responsible for nearly 90% of cases in May, which was the peak of the second wave of the virus in that country. And before Delta, there was the UK variant, Alpha. In March this year, the Health Ministry reported that 7 of 8 samples sent to Carrefour for testing came back positive. Jamaica Pullen, TVJ News.